Hi, I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thanks for joining us in the Veterinary Breakroom. These are short conversations where Dr. Beth and I chat informally about relevant topics in veterinary medicine. And today we are tackling a pretty weighty topic. So we just want to let all of our audience members know that we are going to be talking about violence in the workplace today. If this is something that is upsetting to you and you don't want to listen, we understand completely. But we also feel like this was an important thing to bring up and talk about. There was recently a very tragic story about a young man working in a veterinary clinic that was fatally shot by a client. And so that got us thinking about this topic. And we decided to sit down today and have a short conversation about it. So we actually polled a couple different Facebook groups. They are veterinary only Facebook groups. And so obviously we're not going to name them. We do respect the anonymity of those groups. But we did get between a couple different groups about 217 responses. And we had asked these veterinarians and veterinary staff members, technicians, whether or not they had experienced violence in the clinic. And we asked that in a couple ways. We wanted to know whether or not they had had actual violent encounters or incidents, whether or not they had received threats of violence but didn't actually have physical encounters, and whether or not they have, not experienced any violence at all. And so the results we got back were pretty disturbing. So 71% of people said they had experienced threats of violence while at work. And I thought that was pretty high. Another 15% said they actually had experienced violent encounters or violent physical incidents while they were in the clinic. And then 14% said that they hadn't experienced any threats or violence at all. So, Dr. Beth, how do you feel about these kind of informal poll results?
Yeah, I would say, unfortunately, they don't strike me as overly surprising. Having been in practice for, I think, 12 years now, I fall into the category of having experienced threats of violence. I have not been personally involved in any violent encounters, but they have happened at our clinic, particularly with the front desk staff. So it's alarming. And I try to think about, other professions, and is this the norm across professions that work, whether it's in healthcare, or is it the norm across professions that work with the general public and kind of that customer service relationship. We're fortunate as vets to get to do both, where you've got kind of the customer service aspect mixed with, of course, the high stress of having pets, often sick pets. And I do feel like we are in that kind of perfect storm profession where these threats, again, don't necessarily surprise me. What about you, Dr. Alyssa? What were your thoughts when you saw these results?
Yeah, the biggest surprise to me, I think, was the 15% of people that had experienced, physical altercations. I had really hoped that number was going to be a lot less. And not that threats are okay. Threats are absolutely, you should have a no tolerance policy. But I was a little bit surprised by how many people came back and said that they had actually, had violent encounters in their clinic. Like you, definitely, I think that is a great point and really good insight that, as veterinarians, we kind of are this intersection between healthcare as well as customer service, a little bit more than our human counterparts, physicians and nurses. But definitely, and we can go through some of this data, when we were preparing for this podcast, I went and looked at, what are some professions that do have a high incidence of workforce violence, workplace violence. And healthcare professionals, and healthcare settings really dominated that, which is sad.
And the other thing, Alyssa, too, I think when I look at these survey results, I think it's easy to say, oh, only 15% have had these really negative experiences. And, looking at it and again, having received threats of violence in our clinic, I look at it a little differently where that 71% is not benign. Those threats of violence are not benign. To me, that means, that 86% of us have had our day impacted by fear and disruption and the possibility of violence in our clinic, which is just staggering and yeah, very, very upsetting, honestly.
Sure. And it has to affect how we practice, I can't imagine that daily, even if it's not forefront in the front of your mind, but that daily stress of this could happen, has got to weigh on veterinarians, other healthcare professionals, like you said, the client service representatives, the front desk staff, the people that are on the front lines dealing with clients when they are grief stricken or scared. And we'll talk a little bit about types of violence in the workplace, because they actually type it out into kind of these 4 types of violence, not just for veterinary practices, but in the workplace in general. And so those 4 types of violence are: number 1, somebody who has no relationship, with the victim or the workplace at all. So they say that oftentimes the motivation for that type of violence in the workplace is something like robbery or another crime. So that's one type of violence. Then the second type of violence is what I feel like, we experience a lot. And that is a client, a customer, some sort of consumer who currently receives services at that workplace. And I feel like that's what, a lot of this is for our profession. But there's also, violence between employees. So a current or former employee who is acting out towards coworkers or towards bosses or managers or supervisors. And then the fourth type of violence is a person outside of the workplace that doesn't really have a relationship, with the workplace, but has a personal relationship with someone who works there. So, some sort of like domestic disagreement, or with an employee, a current employee. And so that's kind of like the 4 types of violence that are these broad categories, which I had never really thought about that
Right,
before.
thought about.
Yeah.
Yeah, that is interesting. The other thing, and we'll talk a little bit more about this, and I do want to link this in our show notes too, so I'll have to refer you all there, is that Clinicians Brief a few years ago did what was, I had never read the article before, but it was an article about violence in veterinary practices. And it's unfortunately a long article, and it discusses very specific examples of violent encounters in the veterinary workforce. And I don't want to get us too off topic, but kind of relating back to the different, the different types of violent offenders. There seemed to be a common theme in several of these scenarios where it was actually like a family member of the person who had, like a co-owner of the person who had taken the pet to the vet, which I just thought was a very interesting side note. And I can kind of relate to that. I don't know, Alyssa, do you ever feel that way where like explain maybe a condition very compassionately to the pet owner, they take that information home, give it to their significant other or a family member, and somehow like that compassion, the nuance of the situation is lost, and then you have a very
Mhm.
enraged co-owner at home. I just thought that was an interesting call out that I noticed in the article too.
Yeah, I agree with you 100%. And so a lot of that can come to communication, and like you said, if you're not having that conversation directly with someone, if your recommendations are being relayed second and even third hand, again, not sure that I ever thought about it before, but now that, you've brought it up and we're talking about it, I can remember multiple instances where, yeah, someone has called the wife, the daughter, the mother that doesn't live with them.
Yep.
I've had that one multiple times where I have a long conversation and I get an angry call later that day or the next day, from a parent, saying that I manipulated or scared their 20-some-year-old, child. And it's hard to not take offense to that, to
Yes.
say, hey, we really sat down and had this, what I thought was a very, detailed and good conversation about all your options. And so that's hard, when that gets turned around like that, because I'm sure that anger comes from a place of, wanting to protect your children or your family members. So there's a whole lot that gets wrapped up in this. So there were some other, workplace violence statistics that we looked at. And so did you want to talk a little bit about any of those?
Yeah, Alyssa, you were kind enough to pull some of these statistics, and the one that I'm pulling this up here. So there was one that was done about the prevalence of in-hospital violence about veterinary nurses in small animal practices that you had found and published in 2022, and it was seen that 40.5% reported having experienced incidents of verbal or physical violence or sexual harassment. And I mean, that just kind of goes along with what we, not too dissimilar from what we saw with our own polls. And I do think a lot of times our support staff are the one who are targeted. They tend to be interacting with the clients or whoever walks through the door first. So that was, of course, interesting and depressing. And I think they kind of included those verbal, maybe threats or assaults in there as well. And then I'll let you share, Alyssa. I thought the one on the just the generalized workplace violence was very interesting too, and even one on healthcare workers particularly.
Yeah. So, like we had said a little bit earlier in the episode, healthcare workers unfortunately seem to be the most affected, with workplace violence. Um, there was, a Gallup poll or a survey that said 50% of cases of workplace violence involve medics. And I thought it was interesting there too, that they said in 2021, over 30% of nurses reported an increase in attacks against them, since kind of like the pandemic. And, I'm sure we can all offer, our reasons for why we think the pandemic has accelerated this problem. But nurses definitely in the human health side are attacked more often than the doctors. And so, whether or not that's because they have more physical contact with patients, but it's just something to keep in mind, especially, because that trend seems to transfer over a little bit to veterinary medicine from what I've seen.
Yeah, and like, talking about all this, of course, I think we all want to know, like, what can be done, or what should we
Right.
be doing to help make us, one, feel safer, and then two, actually be safer. How can we support our staff? And just thinking about, the personal incidences I've seen. I know, again, I mentioned that it seems to be our front desk staff that take a lot of these threats, or in a few instances. So we've had multiple times that I can remember that things have been thrown at our front desk staff. So we had someone that threw like the container of milk bones at the staff member. We had someone that threw the whole like plastic business card rack at someone. And it's so scary to think of the people that are there to help our clients, that are the of course the ones that tend to deal with this first and foremost. And so I guess my point is, to me, it almost seems like it tends to be not the ones where you can see it coming. It's hard to predict, is what I'm trying to say. It seems to be, not something where you always have a good indication that violence is coming or that you're suspecting
Right.
it that day or from that particular the person. But in reading some of this data, it was interesting, not surprising, but interesting that they cited that loss of a pet is really tied. And again, not surprising, but that is one thing that maybe you can discuss with your staff, is that loss of a pet is a significant trigger to violence. So anytime those emotions are so high tends to be when you see this loss of control, maybe from some of your clients. So I think it's kind of important to maybe even have that discussion around pet loss and euthanasias, or whether it's, accidental death or medical mistakes or things like that, but maybe having the conversation up front with some of your staff. And that clinician's brief article, there also were a lot of tips about making your vet hospital more secure. And it was a little bit
Mhm.
scary to read. Like, it kind of reminds you
Yeah.
of the unfortunate situation we're in with schools, where, like, you're double bolting the doors and you're
Mhm.
removing the windows and you've got like a one-way lock on the office and things like that. So as depressing as it is to think about, there were some good tips in there for, what steps can you take? What are you in control of? And where you have control, seizing those opportunities to make you and your staff safer. So it's interesting.
Yeah, I think that that's important. It's always uncomfortable to have those conversations or to think about that, but really empowering everybody to come forward with what are their concerns, what are your concerns about how the building is laid out, what would happen, they talk about, doing kind of mock training, what would happen if someone entered the practice with a weapon, and then finally, uh, as as terrible as it is, but if there is a violent encounter, I think really having support for your staff, following that, being able to take time off, to get out of the clinic, things like that. So, you know certainly I've worked at a number of clinics over my career, and we've had threats as well, but thankfully I have never, had a real violent encounter in the clinic that I have worked at or while I was there. Thankfully, I will tell you though, in Las Vegas, um, after the Route 91 shooting, we had kennel staff, two employees that were actually at that festival, and
Gosh.
just watching my community go through that, recovering from such trauma
Hmm.
it's difficult and it takes time and you need help. And so having some sort of, um, plan or help to do with that, whether that's bringing in counselors, something like that, I think is really important. Obviously, prevention is, but also thinking about if something like that did happen, how are you going to help support your staff? So,
Yeah, absolutely. Especially for obviously any serious episodes of violence or violent attacks on staff members, but even thinking back to maybe what could be considered the more minor violent incidences that I have encountered is, really making, like you said, making your staff feel supported, but really having that zero tolerance policy with clients.
mhm.
So, the moment a client alludes to a threat, they're out of there.
Yep.
There really just is no place for that. And I've been in situations too where clients have behaved badly and management has not fired them or gotten rid of them, and just thinking about how that makes me feel, it's just demoralizing when a client treats you poorly and then they face no they're allowed to get away
Mhm.
with it. So just from personal experience, emphasizing how important it is that there's just simply a zero tolerance policy to make your staff, one, make sure they're safe, but also to make them feel supported and like you value their safety and their mental well-being, I think is critical too.
Mhm. Yeah, I agree. Whew, this has been, like we said, a really weighty topic. But I do think very important. And so I hope some of this was valuable for everybody out there. And then to wrap things up, we normally do our win of the week. And I think after a conversation like this, it's more important than ever. So, Dr. Beth, did you have something uplifting to share with us all today?
Yes, I'm going to go very trivial just to counteract the levity of our chosen topic today. And that is, have you ever heard of the Ninja Creamy? Alyssa? I'm not even going veterinary related, but have you heard of the Ninja Creamy? It's not a
I
great
have
name,
not.
but it's a kitchen
No. Is
appliance.
it
I saw your
I
concerned
was going to say, is
face.
it a blender?
It's not too, it's from that same, Ninja brand. It's an ice cream maker.
Mhm.
And more importantly, I got one. And it's not just an ice cream maker, but basically you can turn almost anything into ice cream. And by that I mean like, frozen fruit or
Fruit.
like protein
Mhm.
shake. So what I'm getting at is maybe more nutritiously dense foods than your ice cream would be. So anyway, it's my new food group for the summer. I couldn't be more thrilled about it. And it's also apparently in very high demand right now. So it's hard to get your hands on, which, always makes the ice cream taste better when you know it's in limited supply. But anyway, it's been very fun for the kids. Instead of walking to get them ice cream, I can secretly give them banana protein ice cream before bed, which is good. So, like I said, very trivial, but
That's great.
anyway, yeah.
Oh, that's wonderful.
Should be a
That's
wild
wonderful.
summer around here.
I had something a little bit lighter too. So my parents, for years and years and years, I mean, it's really been almost a decade, have been talking about getting an RV. And they keep saying, we want to get this RV so that the whole family can go travel and do all these things together. And I don't know why, after talking about it for a decade, but they finally decided to take the
Wow.
plunge. And so they bought this, Class A. So we've all been out the last week, fitting the RV and learning how to use the slides and learning how to drive it. And so that we can all, travel around and take these family, trips together. And I'm super excited.
I was going to say that really one-ups my ice cream maker, Alyssa, but I'm very happy for you. That sounds like a lot of fun. Assuming the family all gets along well. Otherwise, an RV may not be ideal, but that sounds amazing.
Yeah. Luckily, we all get along pretty well, so we're excited about it.
Well, Alyssa, it sounds like your guys' summer is going to be very wild too. So thank you for having this important conversation with us today. To our audience, thank you for listening in, and we will talk to everyone next time.
Thank you for listening to today's episode of the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@briefmedia.com. Veterinary Breakroom is a Brief Media production, produced by Alexis Ussery and co-hosted by Dr. Alyssa Watson and Dr. Beth Molleson.